Okay, Mr. Smith. Next, the doctor's ordered some Zofran for you for that nausea that you complained of. Do you care to tell me your name and date of birth? Thank you. So me and the students are going to do this together, if that's okay. You're used to it by now. All right, so we checked our 6 rights of medication in the med room, at the patient's door, and then we're checking again now with the patient, making sure we got the right patient, the right medication or drug, the right dose, the right route, the right time, and the right documentation. And so our medication is Zofran, and the patient is prescribed or ordered 4 milligrams. My vial is 4 milligrams to 2 mLs. So I have my medication, I have some alcohol swabs, a flush, and a syringe and a needle. Okay? So the first thing I'm going to do is just look and see what Mr. Smith has hanging. So we know that we just hung his normal saline, so he just has normal saline infusing through his IV. His medication or normal saline is infusing at 200 mLs per hour. So I can look at his IV site and see that it's fine, it's not infiltrated. If again I had a question about whether his IV was working or if the medication was infusing slowly, I could flush the line. So in order to do that, I'm going to grab my alcohol swab, take my swab cap off. I'm going to swab that hub. And then I'm going to get the air out of my syringe, attach it. Now before I push, I want to make sure that I am closing over or pinching off the tubing for the part that goes up to the bag. What I don't want is anything that I administer through this port to go to the bag and actually be given to the patient. So in order to assess the IV, I'm going to close that off. I'm going to push, and I'm paying attention and looking and feeling, and it looks great. So no issue there. So, okay, Mr. Smith, we're good. We can go ahead and continue. So I'm going to go ahead and draw up the medication. So I'm just going to grab my syringe and needle. My particular one is a 3 ml syringe, and I have 2 mLs of medication I'm going to give, so it's perfect. Anytime that you open a package and you have these syringes that have needles attached, go ahead and give it a twist, because sometimes they're not on there very secure, and when you go to push the med or drop the med, it's going to give air. So I'm going to go ahead and pull back 2 mLs of air, since that's how much medication I'm removing from the vial. I'm going to go ahead and pop the cap off. I'm going to go ahead and scrub the hub. And then I'm going to take my needle with a bevel up, and I'm going to insert it at about a 60-degree angle into the vial. Once I do that, I'm going to push the air, and I'm going to turn it up, and I want to make sure that my needle is as far down in the fluid as possible. Once I get it there, I'm going to release the plunger, and I'm going to let it just naturally pull the medication out. And this is where the air helps. It helps you not to have to forcefully remove the medication. Now, if I need to, I can pull back on the plunger a little bit. Once all the medication's out, I'm going to take it out at a 90-degree angle. I'm going to go ahead and get all that air out. I do have some bubbles in there, so I'm going to tap those out. All right, and then get any air out. Make sure that the fluid's the correct amount. So we got our 2 mLs. Now I can cover this needle a couple ways. So this is an IV injection. So I'm not going to use the needle. I'm going to use the syringe with the lure lock. You can do a couple of things when you haven't used the needle to stick a patient. You can go ahead and do the one-handed, like recap the needle thing, right? So like that, and then push it on. Anytime you're not going to use the needle and you have a safety device on your needle, the best practice is to go ahead and just activate the safety, right? Your needle's covered. I don't have to risk sticking myself even with a clean needle, right? And so at this point, I've got my medication. It's correct. I'm going to go ahead and push the medication the same way that I flushed the line. So I'm going to bend that over. I went ahead and paused my pump because otherwise, whenever I bend this over, it's going to start beeping and it's going to bother the patient as well as me. So I'm going to open my alcohol again and just scrub that hub. All right, and then I'm going to go ahead and take the needle off there and connect my syringe. Again, making sure that I've got that folded over so that the medication is going to the patient and not up to the bag. Okay. I need to make sure that I know the safe rate to push the medication at. So I already checked in my Nursing Central app to see how fast or slow that Zofran needs to be administered. And it just says at a slow rate. So I'm going to just push it slow. Keep in mind that if you're pushing a medication that requires it to be given over a certain amount of time, you do have a good bit of tubing here, right? So we said our J loop was about 7 inches, and we have about 7 more inches of tubing here. So we have about a foot of tubing that we're going to have to push through before it actually gets to the patient. So we have to kind of be cognizant of that whenever we're pushing medications that need to be given over a certain amount of time. Okay, so I'm just going to push this slow. Now, once I've pushed that, I'm going to go ahead and scrub my hub. I'm going to go ahead and get my flush, and I'm going to flush the medication through. And then I just want to make sure that if I'm flushing it through, that I'm using enough to get it all the way into the patient. The other thing that we can do is we can just go ahead and turn the pump back on. It's running at 200, and then let that fluid push the medication in. We can do that if the medication doesn't have a specified time it needs to be pushed over. If the medication does, we have to be very careful letting the pump push the medication in. Okay? All right. And then I'm just going to make sure that I observe the patient for any kind of reactions, see if the medication has its therapeutic effect. So, Mr. Smith, this is supposed to help with that nausea that you've been complaining about. If, it doesn't start to see if you don't start to see some relief in the next 45 minutes to an hour, then we'll see what else we can do. Okay. All right. All right, Mr. Smith, we got one more medication that we need to give you, okay? So this medication is, it's Pepcid. Have you had Pepcid or Prilosec before? Okay. Yeah, it's just for like heartburn, basically. Okay. This medication looks a little different. It comes in something called an ampule. And I'm just going to walk the students through how to use this one, okay? All right, and I see your IV fluids are done, so we're just going to push this medication through that extension tubing or that J-loop. You care to tell me your name and date of birth one more time? Thank you, sir. All right, and once again, guys, we did our 6 rites of medication 3 times in the med room, outside the door, and at the patient's bedside with the patient. So we've checked that we have the right drug, the right dose, the right route, the right patient, the right time, and then the right documentation. So a couple of things a little different that I need whenever I'm pushing medication or giving medication from an ampule. I'll need a filter needle. So a filter needle is going to prevent any glass fragments that break off from not getting into the syringe. Okay, so I got my syringe. I got a flush. I actually got 2 flushes. I'm going to flush before and after the medication. I've got some alcohol swabs. I've got a 2x2, and I've also got an ampule breaker. So when we look at an ampule, it is just glass, right? So there's glass on top of glass. The first thing I need to do is I need to get the medicine in the top part up here out. And so I can do that by just flicking it. It goes out, and then I'm going to break this. I don't want to break it with my hand because it is glass and I could injure myself. If I'm lucky enough to have an ampule breaker, these just pop over the top, and then you're going to break it away from you so the glass goes this way. Most places or most nurses do not take the time to find an ampule breaker, and so there are a couple other things that we have handy that you could grab without looking for one. An alcohol swab. If you're going to use an alcohol swab, do not open it, leave it closed. And again, you're just going to wrap it around and again, break it away from you. The other thing that you may have handy are just some 2x2s. So I've got several there, again, wrapping it around and breaking it away from me. So I'm going to stick the ampule breaker on because I feel like you can see better when I break it. So when I'm breaking it, I'm pushing my hand towards me, and so that the breaking is that way. Okay, and then I'm just going to set my medication down, and I'm going to grab my syringe. My syringe has a needle on it already, but it's not a filter needle, so I'm just going to take that off, and I'm going to grab my filter needle. I'm going to open it, and I'm going to stick it on my syringe. When you're giving medication or drawing up medication from an ampule, you do not need to instill air. There's no pressure in it, so we don't need to do that. So I'm going to go ahead and take the cap off and let you look, see how thick the filter needle is. So I'm just going to go ahead and stick that down in my medication, and then I'm going to draw the medication up. Okay, and then go ahead and get the air out. Make sure that there's no bubbles in. Check to make sure I've got the right amount of medication. I can go ahead and do my one-handed swoop technique to recap that needle. I'm not going to use a needle since this is an IV medication. Keep in mind, if I was giving this medication IM, you cannot inject medications with a filter needle. The filter needle is only ever used to draw medications up from the ampule. If I'm going to give the medication and use the needle, I need to change the needle back to the original one, ensuring that I kept it sterile throughout. Okay. All right. So I'm going to give this medication through my patient's IV. They're not hooked up to any fluids. The first thing I'm going to do is pop my swab cap off. I'm going to go ahead and clean that hub. Right, and then I'm going to grab my flush, my first flush. I'm going to get that air out. And I'm just flushing the IV to make sure that it's working correctly, that it's not causing the patient any pain or discomfort, that there's no swelling. So I'm just pushing to make sure that it looks good. So I push that all in. It looks good. Now I can go ahead and grab my alcohol swab, clean that hub, and then I can inject my medication. Again, I want to ensure that I'm injecting my medication at a safe rate, whatever the rate is. Then once that's off, I'm going to go ahead and grab another alcohol swab, swab the port. I'm going to grab my second flush, get the air out. And when I'm flushing it, I have to flush it because I have to make sure that all that medication gets out of the tubing. When I'm flushing it, I need to ensure that I'm flushing it at that same safe rate that I push the medication out, because there is still medication in this tubing that hasn't entered the patient yet. Okay, so I just want to make sure that I'm pushing it at that same rate. Site still looks good. Got that all in. I'm going to go ahead and grab my new swab cap, stick that back on. I'm going to dispose of my needles and both the top and bottom of my ampule in my sharps container. The ampule is glass, so we wouldn't want the patient or someone else to get cut because we didn't dispose of that. And then I'm just going to clean up my area. I'm going to monitor the patient just to make sure they don't have any adverse reactions and ensure that I've documented everything.